Hey y'all, sorry for the cheesy advertisement. It's 5:45 and we're gonna get started for real right at 6 o'clock. So if you're just tuning in, just hang out, go wash some dishes or something while I figure out where the heck the chat is. Because as usual, I never can find it. And I'll do my selfless promotion, and we got a whole slew of really interesting questions. I think I found it. Yay! We got a slew of interesting questions for the evening, but as people chime in, there is always space for more. All right. Oops. Helps if I know how to type. That would appear to be easy chat. So outstanding. If you've never been here before, I always log on a little bit early in case anybody wants to add a post. And I'm giving my email the last second. Oh, I'm cutting my head off. Let's see if I can remedy that. There we go. All right. I think you can see me now. And if you don't know, if you miss all of it or have to cut out early, hey, Stephanie. Oh, I see people. There we go. Excellent. If you have to cut out early for some reason, I will post this on YouTube on the Tradition School of Herbal Studies tonight or tomorrow, or maybe Sunday or Monday. It just depends how my life goes. I'm teaching all weekend, and that way you can catch all of the old ones as well as all the upcoming ones. Normally we do this on the last Friday of every month, the joy of COVID. And I'm going to be in Colorado next week, so I won't be able to do it. I'm going to be at the Good Medicine Confluence. And I think I still got 2 tickets left. If anybody has wild hair at the last minute to go and enjoy some 50s at night and 80s during the day, I'm super psyched to be going and enjoying that, our winter weather, but I'm sure they love that as lovely summer weather for them. So it'll be a nice little change to huff and puff at some altitude, as well as enjoy the cooler climbs of the mountains there. So I'm super psyched. And if anybody has a wild hair to join me live for real, I am actually at the classroom at 6340 Central Avenue. So I've been doing that in case anybody is like, I hate being online, and some people aren't really Facebook folks, so they can actually join us for real in person. It's always interesting. The fascinating aspect of all of this is, even though I saw you write hi, it didn't show any viewers, so I never really know how many people are actually hanging out and tuning in. So we'll get started here. If you're just jumping on, we're going to get started here right at 6 p.m. And got a slew of cool questions. Feel free to introduce yourself. Let us know that you're here and where you're from, because I always think it's cool when it's from people from far afield. And if you've got a question, feel free to type it in there. Hey, Amanda. I got a slew of questions. I think this is the most questions I've ever had. And just because I'm bored, I'm going to do the silly paper scroll here for folks who look at it later. Lots of cool classes. Yay. So hang out, go do something entertaining. I'm not going to say anything interesting until right at 6 o'clock. Just hanging out so people can find us and figure out how to do this whole live thing. I know it's challenging for me as much as it is for anybody else. So I appreciate folks jumping on here early. I'm already seeing a gang on here. All right, there we go. Let's see if I can babble at my usual breakneck speed. It will be a trick to get through all of this. It looks like I got a million questions on viruses and some puppy dog food sensitivities. We'll leave it at that. My virus stuff, there was another part to that too. Hopefully I can see that while I'm going through here. Cool virus stuff, chronic disease, high calciums in the blood, TMJ, parasites, and TBIs. It's all kinds of T things. I swear there was something else. Oh well, I'll figure it out as I go. Hopefully I'll remember. Oops. Oh, and bone broth. Can't forget bone broth. Lots of bone broth stuff. Alright, so hang tight if you're just getting in here. Feel free to sign on and say hi. Let us know where you're from. Put in a question if you have one, and I will add it into the queue. Oops, I forgot my piece of paper. There we go. Hopes if I have a pen to scribble with. There we go. And bone broth. Bone broth. And high calcium, and TMJ, and TBI. Alright. I got lots of notes. Alright, so if you're just joining us, feel free to say hi, let us know who you are, let us know where you're from, and if you've got a question, feel free to write it in there, and I will add it onto the list. I know we have more people than Stephanie and Amanda, and I'm going to get started right at 6 o'clock, so I want to make sure that all the folks who are coming on right as we advertised, they don't miss anything. What am I forgetting? There we go. And if for some reason, hey Heather, well, you're right around the corner. Hey Natalie, I know some of y'all. Well, I don't have the new schedule with me, but close enough. The new schedule just came out today, and I thought I brought a copy of it with me, but I did not. I'll probably sit in the car, and I'm not going to go and grab it. So, we'll get started here in 6 minutes. Yay! Hopefully some of you caught the class on Rose. I heard it was an awesome class. It looks like Mint is the next one. Mint is always a fun one, but a challenging one to grow here. That's July. August 4th, we got Anatomy for the Herbalist, covering the urinary system. What else have we got? Ooh, Flower Essence. Plant and Flower Essence Basics. Alyssa's teaching that one on August 11th. That one's right around the corner. I bet you that one fills up. We have not offered that class in a long time. When's our next 101? I don't know. November. All right, cool. So if you're just joining us, sorry, for those of you who have been here the whole time, I apologize for the broken record. We'll get started here in 5 minutes, right at 6 o'clock. We'll get started. Got a bunch of interesting questions, and if you don't know, if you have to cut out early for any reason, you can catch us on YouTube, on Tradition School of Herbal Studies, and because I try not to leave them archived here, because I want you all to go there. Look at all the past open forums that I've done, and always interesting things that are covered. And boy, it's different every month. Usually the last Friday of every month. I had to move it this month because I'm going to be playing in Colorado at the what the heck's it called? Good Medicine Confluence. Yay! I leave soon. Get a little reprieve. Hey. All right. You're not. Oh no, you're actually at the top of the list, Kristen. That's perfect. I want some elderberry wine. It's funny. I had a really old bottle of Holy Basil wine that I got at International Herb Symposium a couple of years ago, since COVID shut it down, and it's only every other year. So it was surprisingly still good 3 or 4 years later. So it's a well-made herbal wine can stand the test of time. So feel free to introduce yourself. Let us know where you're from. If you got a question, post it. If you got an herbal tea or an herbal wine, bonus, you'll retain the information even better. Get your go-to cola salad out and a little bacopa and lion's mane or something fun like that. I think it was last month or the one before we did nootropics, and we talked about that a little bit. Ooh, hey Ronnie. More about the Shen and Han switch at night. Said, oh yeah. I will try. That's always a challenging one. Han. Shen. All right. Cool. We might make it today. I will do my best. All right, what am I doing? 3 more minutes. Yay! So if you're just jumping on, feel free to say hi, tell us where you're from, post a question, and we'll get started right here at right at 6 o'clock. I will start babbling incoherently. And if you have to cut out for some reason, and I haven't gotten to your question yet, remember, it'll be on YouTube in a couple of days under the Tradition School of Herbal Studies. All right. Oops, oh, that one goes there. There we go. All right. Boy, I'm almost getting better at this. I can actually find the chat in less than 10 minutes. All right, last check. See if anybody wrote any interesting questions that I can find. Ba ba ba. Nope, that looks like it. Yep, I got all of those. All right, cool. I got that. All right. Need my liquid refreshments. And the clock is ticking down. It looks like we got a good gang on here. And more liquids. And it's funny, I recognize most of the names on here, so I'm glad we got a couple of really good followers here. And spread the word, the more the merrier, and I know a lot of people go and watch it afterwards. So that's awesome that you're there spending a little time on our YouTube channel, so that helps me out in a very roundabout long way. And man, a minute is slow when you're staring at the clock. That's ridiculous. It's been 5:59 for at least 5 minutes. All right, it's 6 o'clock, and we're going to go ahead and get started. I'm Bob Lindy from the Tradition School of Herbal Studies, and this is the open forum I started during COVID because I missed babbling incoherently about herb stuff. And although we're not limited to herbs, I'm happy to talk about supplements, acupuncture, Western Chinese herbal medicine, and do my very best to answer all the questions that are tossed at me. Needless to say, that's cheesy cop-out that every one of us always tries to do, and I'm occasionally good at it. This does not constitute medical advice. Please seek your herbalist that's close to you to find out what's the right formula for you. If you don't know it, Tradition School of Herbal Studies. We got tons of cool classes, traditionsherbschool.com. You can follow us on Facebook, sign up for our email list. We've got a Western and Chinese herbal program from beginner to practitioner, as well as an Ayurvedic series, an open series of just cool herb stuff, where we focus on a single plant for 2.5 hours. And we also have anatomy and physiology for the herbalist that I'm super excited that we started a year or so ago, because I know for so many people that's a weak point. They haven't looked at that good basic science stuff in a really long time. And please feel free to sign up for our email list. We try not to spam you too badly. Hey, John, good to see you. I got your question in the queue. Also, be sure to follow us on YouTube, where I upload all of these recordings. You can see the last almost 2 years of these recordings. And if you don't know, I do this normally on the last Friday of every month. I am going to not be in town then, and I wasn't sure what my internet connection will be. I will be at the Good Medicine Confluence, and that it is going to be my first time going to that conference, so I'm super excited. That is my working vacation. I'm teaching a couple of classes up there next week, actually. I'm going to start teaching Thursday afternoon right on through till Sunday at the Good Medicine Confluence. It's in Durango, Colorado. I still have 2 tickets available that are actually a better deal than you can probably get online. So if you get wild hair and the weekend off, give me a shout and we can get your name on the list. And I think they're $250 actually if you do it through me. And all right, that's enough of the random gibberish. Oh yes, I know it. I will say, for any of you who are planning on taking classes in the future or coming to see us as a practitioner, our prices are going up on the 1st of August. So if you're interested in the Chinese program, or if you're in foundations and going on to the advanced program, you can lock in the prices now for classes. And you can get a package at the old rates that's changing next week. Holy crap. You know, it's funny. I was thinking about it. I think it's the first time I've raised the prices of the classes in 20 years, which is a completely insane number. But unfortunately, our expenses have gone up like everybody else. It's ridiculous. So if I didn't already say it, make sure you say hi, let us know you're here, where you're from, and if you've got a question, post it. I'm going to do my very best to follow along in the chat, but I'm here solo. If you get bored and want to come live and in person, I'm at the school, which is at 6340 Central Avenue. There's not always somebody here, but we have a teaching garden, half-acre teaching garden here, and all of our classes are here at the school. And then our clinic is at 2520 Central Avenue, and that's Monday through Saturday. And we've got our intern clinic there 3 nights a week. Monday is acupuncture intern night. Tuesday is Western herb student night. And Wednesday is the Chinese herb student night, where you can get seen by a senior student at a reduced rate. And then 6 days a week we have our herbalist and acupuncturist. And I am super excited that we have a new acupuncturist and herbalist who also has a degree in nutrition, who will be joining us, I believe, next week. I just saw her license finally cleared today, and I'm super excited to have Martina at the clinic here 3 days a week. And she's available, as are all of our acupuncturists, to do B12 shots, homeopathic injections, and a variety of other vitamin mineral injections. And it's a good way to start or end your week, or if you're running a little pint low, it's a good way to get a little guaranteed absorption pick-me-up. And it's unique that we do them in acupuncture points that increases the efficacy of those injections by a little bit longer stimulation. Where shall I start? Oh, let's go. I did some random order of things here. So I'm going to start with Kristen's stuff on viruses. So there was a it was a lengthy description of the viruses. I'm not going to pretend to read all of those, but I'm going to do a synopsis that she'd noticed a couple of our friends that were getting kind of a week or so long fever, and it was varying from, I believe it was 101 to 104. I'm here to say that 104 is a scary high fever. They appropriately went to the doctor, were tested for COVID and a couple of other viruses, and nothing came through. The doctors went, whatever. I'm just teasing you. I like the detail, actually. I just give the synopsis here. And so they were told to just go back and take a Tylenol or a Motrin or something like that, and that was kind of it. And so they wrote out their fever, or took a Tylenol, and as their symptoms passed, not only did the fever break, they ended up a little colder when they took their temperatures, going down to 96 instead of the classic 98.6. And then for some of them, they had some residual symptoms like brain fog, as well as night sweats that they had not been dealing with before. And hopefully that was my short version of the first paragraph there. So let me start by saying, if you have a fever that's going on for more than a day or two, especially if it's over 102, you probably should go see a doctor. When we start hitting 104, bad things can happen. And in special populations, the very young, the very old, or if there's some other underlying issues, I would say any fever that causes fatigue, lethargy, mental confusion, you probably should see a doctor. One of the hardest things to do when you're sick is to stay hydrated, and of course when the fever's kicking like that, it's easy to get dehydrated, and especially in young children, infants, that can get life-threatening, honestly, in a brief second. So it's funny, this weekend I'm talking about the lymphatic system and immunity tomorrow, so this is a super appropriate question, since most of it's in my brain pretty well, just from making sure PowerPoint and classes are up to snuff. So there are, of course, a million different types of viruses, and whether we're talking vaccines, whether we're talking testing for a particular virus, it's a crapshoot. They just test the most common one at that time. And so, every time there's the flu that comes through every year, and, we're all up in arms over COVID or monkeypox, if you're really following the news. And we forget that the regular influenza that comes through every year is still out there having a good time and getting some of us sick as we go back to a more normal routines, at least here in Florida. And even with the vaccines, when the flu comes every year, they kind of look and see what's going on in China, because those tend to be the next flu, and they take the most prevalent one. There's oftentimes 3 or 4 different strains of the flu coming through, and the flu vaccine is designed to mostly address the one that's going to be the most likely one you get, and that's the one they test for more often. So the reality is, sometimes they work really well, sometimes they mutate, sometimes it's just some other random thing. And in this case, they tested for, COVID, and depending on what test they use, the rapid versus the longer version that takes a few days, it's not always accurate depending on which strain of COVID it is, and also where it is in the incubation period. There's been a lot of false positives and false negatives with the current, the BA5. I've lost track at this point. It's mutating so fast, and it seems like every month or so we have the new strain, and you end up reading about it when it's overseas. And the reality is, it's, in some ways, of course, it's important what strain. If we're talking SARS, which is still out there as well, and based on which family of viruses it is. And so, we all know kind of one is the influenza virus, the flu, and one is the COVID virus, which is a whole slew of everything from SARS to MERS, and our current COVID insanity that's been going on for the last 2 years. And there's herpes virus, where there's 13 different ones in there. Yeah. Okay, good. Yeah, that's the better test. That's the more accurate one. And so all of those are always circulating around, and they usually don't bother to test. They are trying to track the numbers on COVID, so they test for that a little bit more so. Everything in the COVID family, they tend to test for. I know I was on a cruise a while back, and one of the people I was there with got sick, and if it was the flu, they would have been, whatever, here's some stuff, you'll be fine, because the flu is not nearly as contagious. But it ended up being, I believe it was SARS, and because of its more extreme contagion, not as bad as COVID, but bad enough, they were quarantined to the cabin, not just to the ship, until the fever had broken. So it's always a challenge. So, I mentioned that 102.5 is technically now it's high, but it's hard. You have to work at getting 104. That's actually a scary fever in my book, and can cause injury if anybody has underlying medical conditions and so forth. The fever is actually caused by your own immune system, and so I actually, within reason, so that under 102.5, I think it's good to allow the fever to be there, so long as there isn't discomfort. If you're sitting there in agony, if you're delirious, then no, you need to drop the fever down. But the fever is your immune system activating and aggressively going after whatever the pathogen is that's attacking it. And when we do things like reduce the fever unnecessarily, again, in that under 102.5, we actually slow the immune system's response and oftentimes lengthen our illness. So within a comfort zone, allowing for a fever to progress is considered beneficial. The most important thing probably is to maintain hydration, and that's if you're not keeping fluids down, if you've got diarrhea, if you've got vomiting, if for some reason you're not able to consume enough fluids, that's a good time to go to the hospital and get IV fluids at the very least. The problem is as that fever gets up into those higher numbers, 103, 104, 105, it can actually cause damage to the heart, the brain, other organs. And again, especially in young children and the elderly. And those folks can't always, those special populations can't always tell you how bad they feel. I've noticed in the elderly population in particular that they'll get something boring like a urinary tract infection, a UTI, and they won't be cognizant of any of the sensations that most people would identify with that, but they'll actually get mental confusion from the fever associated with it, and it can, of course, in the case of UTI, go into the kidneys and cause permanent kidney damage. And so, anytime you're working with the elderly and they seem to, like, overnight almost end up, it's like, is that the senior moment? Is it dementia? And there's really mental confusion. Their memory in the space of a few days goes the wrong direction. I actually think it's important that you have them tested for a urinary tract infection, just a urinalysis dipstick kind of thing, because they may not have the usual burning and discharge and so forth. They literally may not be aware of it. In young children, in infants, of course, way scary, because high fever can cause death very, very quickly from dehydration, and they can't complain. But what I always look for in young children, infants, is look at their activity level as well. And so those special populations, if they're got 101 or 102 fever and they're out playing, having a good time, and they're eating and drinking, I don't worry about it too much. But you can have 101 and that kid is lethargic and can't climb out of bed, they're in pain, in which case then it becomes a bigger concern. So I think not just the magic number we look for concern, but more how it manifests in that individual. And it's also can be confusing. Some people run low. If I consistently take my morning temperature, I actually run around 96, 97 is my normal temperature. So I can, I've only had this once in my adult memory, if I get 101 fever, and this was 10 years ago, I think, 101 fever, which isn't considered high, actually had me bordering on, it certainly was lethargic, and bordering on, not hallucinatory, but that was 101 for me, because I run low, was actually closer to 102 and a more severe fever. So I think having a baseline of knowing what your baseline body temperature is as important, and we see that with hypertension as well. If you always have low blood pressure, normal blood pressure may be high blood pressure for you, and I think that's frequently missed by the MDs on that. So she had a part 2 to all of this is, and I'll start with the brain fog. A number of viruses and bacteria, for that matter, even if the only treatment we did was water and, let's say Tylenol, NSAID, there can be a weeks and sometimes months of residual symptoms, and brain fog being one of those. Certainly at 104 fever, there may be some inflammation that's residual in the body or the brain, but also the body's immune system has to, for lack of a better name, get rid of the debris. And that, depending on the health of your immune system, your lymphatic system, your elimination, and it sounds stupid, but the amount of water you drink may have an impact at how long that lasts. What we also see is with the current rendition of COVID, and not even calling it long COVID. I think that's, we sometimes are clumping a lot of things, and I'm finding this more and more, that people have some residual symptoms, but I don't know that it qualifies as a long COVID if they just got some brain fog or a residual cough, residual fatigue. Long COVID is usually debilitating to an extreme, but what they found is there's a lot of accumulation of this very sticky phlegm that's just a leftover in the lungs in particular, and sometimes there's some residual inflammation in the heart that is adding to the fatigue level, and it just takes a I hate pickles, just takes us a little while for the body to recover from that. And in cases like that, we can definitely use herbs. Supplements can have a dramatic impact on speeding up, even preventing some of those. But it's important to differentiate, is it leftover, oh, we just got to drink some more water and get the immune system, some gentle stretching, some belly breathing, or do we need to more aggressively address things like phlegm in the bronchioles and so forth. And just generically, I don't have a set formula like I use this on everybody. There is, I sometimes, and it's funny, like I speak both languages, and I sometimes use Chinese medicine, sometimes I use the Western herbal medicine. A base formula that I use when I'm choosing Chinese is Xiao Chai Hu Tong. And it's not limited to the symptom, but it is kind of a tell, and feeling of alternating chills and fever, and we say that as pathogens trapped in the body. And so this is a classic for I'm better, I'm not better, I'm better, I'm not better. And it has the effect of both nourishing and also releasing or diaphoretic, making you sweat to drive out a pathogen. And I'll usually adjust it based on the symptoms that I see. When we start to look at something similar, There's different ways. If we think there's still a pathogen there, we might use something, it's like, did you get COVID? And I'm just using that as an example. And then you got better, and now you've got bronchitis or pneumonia. That's not unheard of, that you caused a weakness from one disease, and now another disease of opportunity kind of comes and hangs out there, like bronchitis. And one that I hand out a lot is OSHA. I find, and yes, you can get a tincture, you can get a pill, you can get it with lots of other stuff. I like just breaking off a piece of root of OSHA, and we just have it at the clinic in a jar, and just chewing that. It is a challenging flavor, but for the lung-specific issues, I really like OSHA when there is still some residual active infection, or there's a lot of phlegm, because it's got a very aromatic, drying property to it. Of course, when it's just like that weak, lingering cough, when in doubt, I always use Biden's Alba. It is both antimicrobial as well as lots of other good stuff. That Spanish needles is the common name, and it grows all over Florida. For those of you not in Florida, it might be a little bit more challenging. It goes south throughout the subtropical areas and tropical areas. Purple tongue would be bad. Sorry. There's possibility of a purple tongue, but that's usually the blood is stuck, and I get really concerned that they're not getting oxygenated if there's a blue or purple on the tongue. A purple tongue that wasn't there before but now is, I would say, wouldn't be wrong to make a trip to the doc. Definitely more aggressive approach if we're doing it purely herbally. But a purple tongue can be indicative of a stickiness to the blood. It's basically a stagnation, and so Chinese, we would call it a blood stagnation. We would call it just a tense condition affecting the circulatory system in more Western language. And likely would use an herb, Dan Shen in Chinese, but we're starting to see that in the Western herbal uses now, salvia, mitza, whatever the heck it is. So not Dang Shen, but Dan Shen. Dang with a G. Is Cotinopsis, so different animal. Danshen is a salvia very specific for the heart circulatory system and a tense or stuck blood. So there was an interesting symptom that she saw materialized for a couple of them, and that was the night sweats, where they were actually a little cold, and then it was a night sweat, and that's not uncommon to see. On at least one of the people that she mentioned, she was around menopause, and so it could be an aggravation of menopause. There's definitely, and again, I'm beating up on COVID, but we oftentimes see a hormonal shift as the body activates its immune system and processes those out. The inflammation that's caused by the body makes some of the hormones not respond as well, because all of the cells in the body are also inflamed. You'll also find that sometimes the medications they use, like if somebody's given a steroid, that can cause an aggravation of any number of hormonal symptoms like night sweats. That will probably go back to normal sometimes I like to talk crazy Chinese stuff because it just fits better. In this case, you had a high fever, which is an excess heat in the body. And using that energetic system of hot, cold, wet, dry, deficient, excess, tense, and lax. And for those of you who are in class tomorrow, we're going to add a new version of that, interior and exterior. That the excess heat, think of it literally as a fire, consumed some of the fluids of the body. And so they ended up with a lack of fluids, creating an underlying dry condition. In Chinese medicine, we call that yin deficiency. And in that case, we have the classic symptoms are night sweats and hot flashes, a malar flush being a redness right here on the cheekbones that wasn't there before. And then we look for things like the hands and feet in the center of the chest are sometimes warm. You don't have to have all of those. That these are warmer than the arm or the body. And so that would be a yin deficiency kind of thing. Sometimes we'll see constipation. And I would say it's very important to literally make sure that good stuff is going in and waste is coming out, so that they're peeing regularly, that their bowel movements are normalized. I see a lot of constipation coming COVID, post-COVID, or high fevers in general. Sorry, my pause. Yeah. And ginseng can definitely, it's funny, in the Xiao Chai Hutong, ginseng is one of the assisting ingredients in there to support the foundation as we expel out that lingering stuff. And, it's funny, and she mentioned a couple of herbalists who I have a great deal of respect for that she was following online, Thomas Easley and Jim McDonald. Jim's definitely one of my favorite herbalists and teachers. He's up there. That they were using things like betony, and there was a specific protocol that Thomas Easley was using that was holy basil and damiana. There we go. I found it in there. And so, are those good protocols? Oh, I never used them. And so whether or not those are correct, it's really the importance when we say this herb is good for, it will fail half the time. And so it's always important that we look at the herb or herbs and look at their energetics and look at how that combination can address the individual and their unique patterns, both their constitutional pattern as well as their current acute pattern, in a case like this with colds and flu. And so it's funny, the wood betony there's a lot of different ways to think of wood betony. In one way, and I personal opinion here, it's been my experience working with it, there is wood betony, which is a European herb, and I think I've mentioned it in the past. The idea, there's an old 14th century quote of sell your coat and buy betony, because this is such an amazing herb that it's more important than a winter coat in the wintertime. And there's two ways to think of wood betony. We think of it in this day and age as kind of this adaptogen, something that helps you adapt to stress, mild nervine, slightly cooling. But if you look at its historical use, it was actually used for things like the plague. And so it was considered to be both an antimicrobial as well as an adaptogen nervine, which really makes it, it was used for like ulcerations and boils and all this ooky stuff. And so I would argue, and I don't, honestly, I forget, we've categorized things as diaphoretic, then adaptogen, and diuretic. We have these categories that we put herbs in, but because herbs are multidimensional, they're not a single chemical. Is it golden seal or is it the berberine? Berberine being an individual alkaloid that we extract out of a plant that has thousands of different chemicals in it. And so it is not wrong to think of betony, and both Stachys officinalis, the wood betony, as well as Stachys floridata, which is our Florida betony, rattlesnake root here. I think it also has an appropriate standing as an alterative. And alterative is one of those words that is confusing, to say the least. And alterative is this idea that it normalizes tissue, or is either a tissue state or fluid and so forth. So these are herbs that will literally take something that is dysregulated or out of balance and re-regulate it. Wood betony is kind of a wild card in that, and there's some really mild ones like wood betony that has multidimensional, red clover as an alterative, but then we have other things like Dan Shen would probably be considered an alterative if as a Western herbalist. So I always hate commenting on other people's formulas, because like Damiana and wood betony, for post-COVID, like, I never would have thought to put those two together, honestly. So the reality is it's worth trying those, but always make sure the energetics matches. Like, how much of each one? It would depend. Do we add other herbs into there? What do you have access to? I know Thomas Easley always has some interesting approaches to things, some of them brilliant. He does a lot of it based on research and chemical isolations, which I don't do that much. I'm really pretty fanatical on the whole energetics idea. I kind of beat that into students' heads. And so I could talk for days on this one page. Another part of it that she brought up is dysautonomia. And dysautonomia is honestly kind of a newish term. So much to do just on that page. Dysautonomia is a dysregulation of the autonomic nervous system. I'm sure I said that right. So autonomic nervous system is kind of the nervous system that you don't think about. So your heart is beating, your brain is telling your heart, keep pumping, and you can't say stop pumping and literally make your heart stop. That would be bad. And so we have a number of things that our body does without our conscious input. And so dys is bad. And so dysautonomia is a disorder that literally, I think 15 years ago, I'd never heard of. And all of a sudden, I would say, especially since COVID, has become epidemic / rampant. And I think is too often disregarded by the MDs. It's kind of like fibromyalgia 25 years ago, where it's like, what was it called? The yuppie flu was chronic fatigue and fibromyalgia, until they were like, oh wait, this is an actual disorder. Maybe we should figure out how to do something for it. And so the dysautonomia in its most classic sense is a lightheaded or dizziness or anxiety that comes because the body doesn't regulate the blood pressure well. And like the cardiologist would say, ooh, that's primarily what it is. And their treatment is have more salt and drink more water, which kind of doesn't work most of the time. It certainly, if you are dehydrated, then it works. Because we don't think about it, that our body, part of the autonomic nervous system, as it notices a change in blood pressure, will literally constrict. Like if you're laying flat and you're laying in bed and you jump out of bed, if you do that too fast, sometimes you get a little dizzy, sometimes you get a little lightheaded because you got up too fast. And that could be because you're dehydrated, that could be because you're a little anemic, or it could be that you have your body didn't respond by increasing the venous pressure in the lower part of your body to adjust for that change in altitude, if you will, on your body. So it is all the symptoms that can come from that, but it doesn't always happen from dehydration. It is, when we talk about dysautonomia, we're specifically saying your nervous system isn't doing its job correctly to adjust to these changes in blood pressure, ultimately, is usually what we're referring to. And so using nervines to help with that, adjust the nervous system, specifically that autonomic nervous system, can be helpful. And wood betony would be a good one for that. Any of our adaptogens or nervines might be helpful. And I think you asked specifically about oat-tops or milky oats. And although I'm a huge fan of milky oats. I think we just bought like 25 pounds of fresh milky oats that was overnighted to us here. That we made a bunch of fresh milky oats here and got a bunch for our students. In this case, it may or may not be correct. Wood betony, you're not going to go wrong. Holy basil, huge fan of that for a million things. But the moistening aspect of the milky oats could actually, if there's a big phlegm condition, there's like a lot of, and it doesn't mean you're necessarily going to be coughing stuff up, but a shortness of breath, wheezing, things like that, where there is that pockets of phlegm still in the lungs, the milky oats could help that, or maybe not. Sometimes you need to moisten in order to get it out, but something really boring and basic like milky oats would not be wrong, but even marshmallow to help do that, and then using other things as the nervines. But also the cooling moistening of milky oats might not be correct. So the reality is there's an endless number of herbs that you could be using for that. Sometimes I just like boring stuff like, let's go pick some bitins out of your backyard, see how you do. And sometimes that's enough. It's funny. I was on it's pretty much defunct now because everybody's kind of got their protocols the way they like them. There was a group of senior herbalists that created a group that was specifically to share their experience with COVID and what they were having success or not success with. And what it turned out to be was like half the people were just doing off-the-wall things that I have no idea whether they're helping or not. Things like nettles. I was like, that probably isn't going to help with COVID. It's not going to hurt it. But for unique symptoms like the loss of smell and taste, sage. I was like, I would have never thought of, like, literally stuff the turkey kind of sage, Salvia officinalis. I would have never thought to use that. It was brilliant, and it works more than half the time. So it is about matching things up based on their energetics, or that they may be good for a single symptom. So that's not wrong to look at that approach as well. And did I think I might have missed something else. Oh, and the brain fog. Sometimes it can be as simple as looking at anti-inflammatories. There's not an easy way to tell if there's inflammation in the brain. And that, when we start thinking about meningitis and other things like that, that there are things that can have long-term consequences like that. I like the nervines for that. I particularly like Gotu Kola for any time I suspect some level of inflammation in the brain, and we see that from everything from ADD, ADHD, to autism, to residual inflammation after a viral disorder, something as simple as Gotu Kola. And my joke on Gotu Kola is the dosage is yes. You can literally make a bowl of soup. You can make pesto out of it. I literally go out in the yard and just eat it if I'm feeling some brain fog. Although I know the lion's mane is all the rage, for something that's an acute onset disorder, we're not trying to grow new nerve tissues or neurons or the covering over the nerve fiber. Literally, we're just trying to knock some inflammation back in a place that's difficult to access through the bloodstream. And so lion's mane is more of a long-term kind of thing, and most people aren't, they're putting it in their coffee, except if it's a whole mushroom, you're basically wasting a lot of money because mushrooms have to be processed a little bit more aggressively, and the dosage is to be effective is usually way more than the 1 or 2 grams that people are taking. There's a fun local restaurant here on 22nd Street South near Three Daughters Brewery, Seoul, and they have a lion's mane steak that's literally just a big old flattened lion's mane that's been marinated. So that's like probably 20 grams of mushroom. So that would be the equivalent of 20 plus capsules. And I don't know, I had it was super yummy. I don't know that I was a brilliant genius after that. So that's more long-term than short-term. So looking at that short-term inflammation, the Gotu Kola seems to be specific to connective tissues. And when we think of the dura coating, the protective coatings like the dura over the brain, the meninges, the dura, that is a type of connective tissue in a roundabout kind of way and seems to really reduce that inflammation. So I like it. Blah, blah, blah. Yay. All right, that's enough of that. Let's talk about the puppy dog. I don't know whether you're on here, Heather, hopefully. And I'm so sorry. There was a screw up. I don't know how we screwed it up, but I am running off to the good medicines confluence in Durango. Yay! Which I'm super excited. My first time going out there, and I'm super jazzed. All kinds of interesting classes. And somehow the dates didn't get transferred into the book, and I won't be there to supervise. So we had to cancel student clinic on Tuesday and Wednesday. And we had it canceled for the following week because I'll be gone full week there. Oh, there you are. Awesome. And so she had her puppy dog, and sorry, I don't remember how old your dog is. All dogs are puppies to me. I love puppy dogs. Her dog's really been struggling, and unfortunately it's a really common thing that you're struggling with, or your puppy is, that some dermatitis where the dogs end up scratching, itching for no obvious reason. It's a 7-year-old puppy. But they're all puppies till the day they pass. I'm going to come back in my next life as either a squirrel or a puppy. It's so common here in Florida, more than I think in the rest of the country. They end up getting the hot spots, they're chewing, biting, sometimes they're going after their feet, their butt, their belly, their hair's falling out, they can get literally pustules, to the point where you need to literally get antibiotics and steroids for the dog. Like it is the right choice to do that, as much as I dislike doing that for two-leggeds or four-leggeds. What I've found, and it's challenging because sometimes it's like, oh, it doesn't happen in the winter, it just happens in the summertime when the fleas are rampant, and even if you're putting on the flea and tick and all of that, they still kick your butt. Once they're in a yard or in a house, it can take a year or 3 or 4 in order to get rid of them. And what I found is there's oftentimes some environmental irritants. And so too often, you're in a condo complex or an HOA, and so they're spraying the lawns, the dogs are walking through the grass, and so they're literally picking up poison and frequently neurotoxins from the grass or the surrounding area that they're playing. And I tend to see that more on the paws. When those are getting red, they're biting or licking between their toes and things like that. When it's the fleas or a food sensitivity, it tends to be on their butt or their back or their belly. And one of the things I find is so many of the foods are inflammatory, and even the popular ones, yeah, guarantee they're spraying the marinas at this point. There's a cyanobacteria that's out of control right now. So I usually start with the food. It's not that grains are evil, it's the quality of the grains, the quality of the meats, and so obviously it's challenging for anybody to sit there and make dog food and doing the research that's necessary to do a raw food diet, and getting the right combinations of nutrients in there for their dog. So trying to find some of the foods that have less ingredients, and that's my short answer is we probably want the proteins at the top. You want the least processed foods, where it doesn't say like fish juice. It actually says, whole white fish, whole salmon, and I would want that wild, if it was a fish, I want it to be one that's not factory farmed. I won't eat factory farmed, I won't eat tilapia, I won't eat the factory farmed salmon or catfish or trout. I will happily eat the wild caught ones. And think about I won't say all of us, but oftentimes the folks who are pursuing herby stuff, that we're very cognizant of the quality of our foods and the importance of that. And as somebody, I got chemical sensitivities, if I have a little bit of fun with my food, I'm going to be sick. You'll hear it in my sinuses. It's like, I don't have COVID, I had something yummy. I had chicken wings last night, whatever. If it was not a high quality, free-ranging, organic, then I am likely to, within 12 to 24 hours, you'll see it manifest as inflammation on my body. And In dogs and cats, the same is true frequently. So I would say start with the food as a longer-term fix. When you need to use the steroids, use the antibiotics, they suck, but in the same way, if I were to take an antibiotic, I would immediately start taking probiotics, and I would recommend that to any of my clients. Dogs and cats have a different gut, but still have good gut biome. It's manifests a variety of different good bacteria in there. And so don't necessarily give them one of the people ones. Yogurt's not necessarily their friend. So making sure you get a pet probiotic, and they sell those in the health food stores. We carry them at the clinic because we see enough puppies that it's necessary. And part of the treatments that they provided you from the veterinarians was basically antihistamines and steroids. And so we can do that herbally as well, and it can be more specific. And I'm going to give you like my starting point. Nice. But the starting point that I usually use is stinging nettles, which is very dog and cat safe. And dogs are usually pretty easy. Cats are harder to get the herbs into. Dogs, you just throw it in their bowl, mix it with something, they'll be fine. They're usually not too picky. The other one is burdock. And those can just be ground up into a powder. You can make tea or a decoction out of those, and mix those into their water bowl or their food. Oh, hey, Tabitha. I don't remember whether we have that in ours or not, but burdock kind of reduces inflammation in the gut, which will manifest on the skin, and is specific for dealing with the mast cells, which is part of that root inflammatory response of the body. But it's very moistening and cooling, so if your dog already has loose stools or smelly diarrhea, not too strong on that in the front end. The stinging nettles is very nourishing. Oftentimes when they've gone through multiple rounds of antibiotics and steroids and so forth, they're a bit depleted. And so the stinging nettles is both an antihistamine, but also very mineralizing, very nourishing, and is a little bit more drying. So we can adjust that based on the energetics of their poop, honestly. You can also do topicals. And any of your healing herbs, and you always want to make sure, even though it says like, no, this is good for, it has to be something they can eat, because they're going to lick it off. But using things like plantain, calendula, can be very soothing. Bidens, the Spanish needle that's local, can be really helpful as a topical. A lot of times dogs feel like they're being punished. People use spray bottles sometimes as a training tool. So spraying the hot spots is great unless your dog is traumatized by that and they feel like they're being punished. So depending on how your puppy responds to spray bottles, you can either use just a cool compress on there multiple times a day, or the little spray bottle whenever they're around, and that can help soothe it. If it's an active infection, these things like herbs with berberine, brain cramps. You can use things like Oregon grapefruit, yellow root. Golden seal's not wrong. It's really expensive and still a harder to access decent one. So I tend to use the Chinese herb coptis, which is known as huanglian. Is a nice anti-infective to use topically as well. Looking at, and I think if I remember right, you'd mentioned the ears, and boy, when I see the ears going, I almost always blame the food. If it was there before the first round of antibiotics, it's the food. The running joke when we teach the herbal pet care is smell their ears and their paws. If they smell like Fritos, corn chips, it's a yeast fungal issue, and I'm going to say most of the time goes to the food. And Tabitha's one who works tons with critters. She's down south, the southwest area of Florida. I don't know, you're way the hell down there, 3 hours away. But really does a lot of work with both her own animals, and I think she's been put to deal with all of the worst cases of all of the farms and critters around there. And she brings up a good point that sometimes not only is it things like the grains or the overprocessed foods, but sometimes the protein in particular is a specific issue. And so as a general rule, we can look at the energy. Thank you. I know you're down there somewhere. I was like, poor Red, I couldn't remember. Brain's hurting at this late a date. But I find the fish, the white fish, tends to be the least reactive when we look at it, but we can also look at the energetics. Like venison and duck is very heating, and chicken, for some reason, there's a lot of sensitivities. Beef, and lamb, there's sometimes a lot of sensitivities. Lamb can be very greasy and very warming as well. So, and as you experiment, I hate to say this, experiment with finding the right food, it's also important to recognize that a dog's been eating the exact same food for years oftentimes, that to all of a sudden dramatically change their food can cause some stomach upset, some accidents, some diarrhea. And so I find sometimes a more gradual, like a week or two transition to a new food is kinder to the belly for them, and you don't have to clean up as many messes. Oh yeah, it's totally food, Heather. So we'll get fancier than that when we get you in there. You would not be wrong if you're nearby to either hit the clinic up for a probiotic. We have, of course, the burdock and nettles, and a lot of the health food stores like Rollin' Oats also has some pet probiotics. That's at least a good start. The burdock and nettles, you definitely need an herb store to find those to get the good stuff. And literally I would just grind them up and start adding them in the food. I'm going to say half a teaspoon for every 10 pounds in the food. Is probably a decent rule of thumb of the total herbs, and you can just start those half and half without any real fear of badness. And I don't worry about herb drug interactions. There's definitely fancier stuff we can do. Just one of those, it depends. Let's see. Oh, and I pulled the book out because I got your question. I will. Oh, good. This, for any of you who have critters, dogs and cats in particular, I love this book. I have all the fancy books, and you can get this on our website. We've got a couple of books we recommend off the school's website, Tradition School of Herbal Studies. But the 4 Paws, 5 Directions, I have all the books that, like the veterinarian training in Gainesville, that's where they all learn herbs and acupuncture and Chinese medicine. I got all those books. I literally go to the 4 Paws, 5 Directions. And admittedly, if you buy them off the website, I'll make $1 off of it, so I do have a vested interest. But the author does not give me money. But they have like acupressure points, and acupressure is super effective for critters. You don't need to know Chinese medicine. They go through really good descriptions as to how to understand the dogs. It has common herbs and supplements, both Western and Chinese, that you can use without any real foundation. I find they have really good information as a whole. For chickens, the Chinese books do a better job, the ones from Gainesville. I actually oh my God, is it Peter Chen? No, whatever Chen and Chen's first name is. I don't like his book. I like the one that comes from directly from Gainesville for the Chinese teacher up there, because they do list the dosage and formulas of both common herbs and formulas for everything from rabbits to chickens to llamas to horses and elephants, for reals. And so it's a little pricey investment, but chickens are usually pretty easy to fix too. They tend to get just injuries. They'll Chickens are mean little raptors. They'll poke out at each other's eyes. They'll get some wounds from another animal. I usually will just get a spray bottle and try to wrangle them and hit them with some calendula and plantain. And if they get some of the interesting foot infections that are common on chickens, I'll put a decoction of really strong herbs in a shallow dish at their entrance of either their walk going in there, and of course, as they're going into the roosting area, and of course making sure that you, especially when there's weird bacterial things that chicken get in their feet sometimes, that you clean that up so that there's nothing hiding there. I've had a lot of fun treating my own chickens and my neighbors' chickens on occasion. Surprisingly good success sometimes, because it's a challenge sometimes. All right, I know, John, you're on here, so let me talk. All right, we got doggies, we got all the cool virus stuff. Bone broth. Bone broth fixes everything. I do recommend bone broth a lot. I think both from a cost perspective and a quality control perspective, I think it's better to make your own. And although I understand Instapots are amazing for everything, but especially bone broth, I don't know how to use them. So I tend to use crock pots. Big old like 6-quart or larger crock pot. I know that's why you're on here, John. So there isn't a set like this is how you do bone broth. There's so many different opinions. For folks who are anemic, I frequently awesome, Heather. I look forward to it. And I always like it when somebody brings their puppy into the clinic. I get to play with dogs then, as does the rest of the staff. We're pretty stupid over dogs. But when I see anemia, if I see that Chinese concept of Jing deficiency, that congenital essence is declined, if I see osteoporosis, menopause that's not responding to the usual stuff, I think bone broth is a winner. Long illness, childbirth, surgery, I think bone broth is a winner. It can be made also to just be kind of a help to strengthen the immune system to keep you healthy. It's challenging, of course, if you're vegetarian or vegan. Bone broth gets a little bit more challenging because it's an animal product. There, for folks who are or pescatarians or ovo-lacto, there's some possible ways to go about dealing with that. But I personally believe that using the long bones, the marrow bones of either a wild game or cow, bison is the ideal for this. Of course, my preference is always grass, free roaming, grass fed, as ethically raised as one can to get a food animal. I would not use factory farmed animals. I just yuck. And too many potential hazards with that. So if you're not able to get some version of organic, free-rangey, I would probably end up investing in it. So classically what I've done is I'll pull herbs based on the individual, and the premise, I use either, helps if I know how to type, 8 treasures, or some version of the Chinese formula Bazentong, and I'll adjust that as necessary. But Rhamania, astragalus, ginseng, all the mushrooms, cordyceps, reishi, are all good additions. So I'll gather all of the herbs that I want, all the herbal medicine that I think is important. I'll frequently add in a beet or 3. A lot of recipes will ask for seaweed, kombu, whatever, and that's just more diversity of mineralization, so it's nice to throw that in. Because usually when you're making bone broth, you're going to be drinking that for a while, and so I try to add things that taste good in there, like onions and garlic and so forth. You don't have to. Salt and pepper is appropriate, but I think what's most important is how we prepare the bones, and then choosing the things that we put in there. So I like to set the oven to 450, 500. I'll put the bones in a roasting pan of some sort and literally just drizzle some apple cider vinegar on there. And I won't say a little past just browning, like you're going to cook them a little bit. If you want to be hardcore, turn them and try to get a little bit of color on all the way around on all of the bones. Then placing those into your crock pot, Instapot, and put in all of your herbs, whatever you got, stuff it in there, and add water. Try to cover all of it with water, and I'll put it up on high with the lid on until I bring it to a boil, and then I'll reduce it to a simmer. I'll continue to add more water to that, and I would say at least 24 hours. I actually like 2 to 3 days. So you need to continue to add more water. And if you're able, I would actually continue to add herbs into that. So you stuff it full of all of this stuff, it starts to break down, the water gets absorbed or evaporates. We're adding more water if it allows, like I want that thing jam-packed. And I forgot, and also put a little bit more vinegar, and anywhere from a quarter cup or less of vinegar into the crock pot with your bones and all of your herbs. At the end of all of that, like squeeze those herbs, get all of that stuff out of there. That is your bone broth. Some people will simmer it down once you removed all of the herbs that didn't dissolve into it. Some people will put it into a really strong blender and even grind some of those leftover herbs up. I don't usually do that because a lot of times it's just fiber at that point. Something like ginseng you could if you wanted to, but 3 days of cooking, you've got all the good juice out of there at that point. But really important to, in some way, press those herbs so that there's no water left in those. You can use a potato ricer, you can get a towel and just squeeze them out, put it in a strainer with a weight on top of it, whatever works best for you. Some people really need the fat that's in there. Other people, if you don't have a gallbladder, if you have a challenged gallbladder, if you think it's disgusting, they'll take whatever they've got. And I always say small containers, glass, so like mason jars. I think this is about 5 days if you didn't fill it all the way to the top. If you did like up to here, that would be 5 days. So can them in like 5 days. They can stay in the fridge for that long. Freeze some of them, and then every week, every other week, you pull out one to thaw in the fridge, and that becomes your dosing. It will literally, in the fridge, it will separate, so you'll get a layer of fat on top. I find it gross. Other people like it. I usually remove that fat off the top. It's challenging for me. Back in the day, I used to like it, but not anymore. And anywhere from a half a cup to a cup daily, depending on whether we're looking at health maintenance and just general nourishment, or somebody just had a baby or major surgery and we're trying to significantly recover from that. There are so many benefits. Like, I hate to say it, Google it. There's so many values. It's helpful for people who have gut permeability issues. If you've had a lifelong antibiotics, if you had lifelong water bath or pressure. Yes, totally. Yeah, I don't do a lot of canning, not my forte, but yeah, you can do it that way. I know people who've put it in ice cube trays that are like single servings, especially if they concentrate it down, and they've actually like just have a bag full of frozen like 1-inch cubes and just throw that into a coffee cup and warm it up. You can also, if you're like, yeah, this is challenging, you can use it as a base for soups. You can throw it into a pot of rice. You can use it as a base for soup. You can put it into a stir fry. So you're not limited to doing shots of bone broth. That is not everybody's idea of a good time. It is one of my go-tos for dealing with folks going through chemo. If somebody's going through chemo, we have to limit the herbs that we put in there, so we got to be careful with those herbs. Ooh, our back door is open. So I usually stick with the mushrooms for that as my primary approach. I don't know. The other variation of that, so like I said, yes, the beef stuff is the best. I would say chicken is okay. Like, think about that. That's old school. Like, back in the day, I know my grandmother used to do it all the time. Like, you got a chicken and you took that carcass after you cooked it down and you threw that in a pot with all the, she would always save, you cut off the ends of a carrot and celery and she always had like just a bag. She'd throw all that stuff in the freezer. And once a month, when she had a carcass of something, all of that would go and make soup. Fish heads are really fatty, and so you can usually really cheaply get the spine and the fish heads and make a bone broth out of fish heads. So for somebody who is a pescatarian, somebody who's transitioning from being vegan, fish can be a more gentle way of doing it and highly nutritious. And not quite the same, but close, is if somebody's vegan, they're not going to do a bone broth. You can definitely do a very strong mushroom broth, and again, putting all of that stuff in there can really have some good outcomes. So, we had somebody here in St. Pete was trying to open up a bone broth restaurant bar, and COVID hit, and I'm going to say there's a huge storm coming through, so if I lose connection, I apologize. Hang out, and I'll try to get the connection back. But she tried to do it out of her home and was literally struggling to keep up with demand. And she was doing it right. She was putting all the right herbs in there. I don't know where she learned it, and she was cooking at least an hour, at least a 24-hour period for all of her stuff. So huge benefit. I'll add to that very classic the Wuchi Bai or Pai Feng Wuchi Bai Feng Peng is black chicken white phoenix soup, which literally uses silkia black chicken and basically throws all the nourishing herbs and Chinese medicine into a pot. That is a version of a bone broth, but using a very specific bird. That is the go-to for post-surgical, after childbirth, long illnesses, things like that. So very appropriate to don't think must be, long bones of a bison, blah, blah, blah. Sometimes, man, it's just scary sounds coming back there. There are variations of this that we can create that meets our needs and what's available for you. And generally, you're putting all the nourishing herbs in there. Being more careful, like people will throw in some of the more anti-cancer herbs that are strong. They'll like Baihua Shishi Sao, Oleandia, not oleander, Oleandia. They'll throw in a lot of burdock and dandelion. Those are different. Those are no longer nourishing. Those are more about getting stuff out. So thinking about what the action of those herbs are that you put in your bone broth, and you can create bone broth for very specific functions. Usually we think of bone broth as a nourishing thing. doing bone broth fasting. So it's kind of the same idea of khichdi or kanji is a thing, because we have packed all of those nutrients in there, but we have it as a soup, and just thinning it out a little bit to make it more palatable. And we're halfway through, and I'm actually halfway through my list, pretty much. So I'm going to do a short plug. If you don't know it, if you're just joining us, I'm Bob Lindy, Tradition School of Herbal Studies. This is the open forum we do normally the last Friday of every month from 6 to 8, but I'm going to be out of town at Good Medicines Convergence, and I'm going to do selfless plugs for any of you who are acupuncturists. And I would argue, if you're thinking about going to acupuncture school, the FSOMA, Florida State Oriental Medicine Association conference is coming up in Orlando in just a few short weeks. It's like the middle end of August. And so I think I'm teaching half the dang conference. It's a long story, but I'm teaching a bunch of really fun classes. If you're an herbalist who studied Chinese herbal medicine, this particular year's conference, every other year we get relicensed, and so they do very acupuncture heavy classes at the FSOMA conference. This one is not a relicensure year, so they're a little bit footloose and fancy free, and we tend to do a lot of herbal classes. I'm doing bioregional herbal classes up there this year, and some other interesting things. And what else is coming up? August. I've got the AHG, the American Herbalist Guild, which is our professional organization as herbalists, has got their conference coming up in Pennsylvania in October. For every herbalist, it doesn't matter what your skill level is, this is the conference to be going to. AHG, check out American Herbalist Guild's website. I'm super excited to say I'm going to be talking shit there. So I'm talking about poop and what our poop tells us at the AHG conference. And Ruthie, one of our other teachers here, is going to be talking about an intensive just to learn about cinnamon. So it's really exciting that we have two of the teachers here from the Tradition School of Herbal Studies is going to be teaching at the AHG conference. So I'm considering that quite the privilege. And those are the only ones that I can think of off the top of my head. I will say we're about halfway full already for the Chinese program this year, which starts at the end of October. So if you're interested in getting the Chinese program, contact Tricia soon. And I don't know, also our prices are going up even for our classes. I haven't raised our prices in 20 years, literally. So if you want to get in on our current prices, you can get registered and pay in advance, at least for the first class. If not, if you pay in bulk, you get our current prices. And for any of you who are in the Western Foundations program, you can get in the advanced. Go ahead and sign up. If yes, for sure, either the first class to at least get a little bit of a discount on that before the prices go up, or you can pay for the whole thing and get that. We've got some one-on-one classes. I got a couple of herb walks coming up as it cools off. So check the schedule. I think it's all online right now. And of course, check out our YouTube page, which if you don't stay for the whole thing, you can check out this recording and all the past recordings of the open forum. So, Tabitha, you had an interesting question. All right, that was enough of the selfless plug. Back to the good stuff. So, elevated calcium levels in the blood, so that's something that can be picked up on a CMP, a complete metabolic panel. And in this case, it implied that it wasn't just, it's a little high. It sounded like it was a lot high. I think blood work, as herbalists, we tend to be, at times we get really down on Western medicine and like they're doing everything wrong. The reality is Western medicine is a valuable source. You get hit by a truck, go to the hospital. You get a horrible antibiotic, you can't breathe. No, go to the hospital. They will save your life. There's certain disorders for a variety of reasons that we need long-term medication. So one of the most amazing things that I think Western medicine does is blood work. It's literally, it is giving us vast amounts of information, and you can go really deep dives into that. But the very basic information that you get in your annual blood work The CBC, the complete blood count, I like the differential where they add some extra immune marker stuff in there, is amazing information. The CMP, complete metabolic panel, I personally always ask for vitamin D levels, B12, as well as a full iron panel, which includes ferritin, TIBC, iron and iron saturation. I think everybody should screen that periodically, just to get a good baseline, and then specific tests based on what you've got going on and your needs. So when you see a really high calcium, there are a number of possible different reasons for that, none of them particularly good. The most common reason for slightly elevated is honestly just something stupid like dehydration. But it's can be, and frequently, probably the most common thing is a parathyroid. So we have a thyroid, but then we also have a parathyroid that helps maintain calcium levels as well as other things. And it's you definitely need to go to an endocrinologist that specializes in parathyroid in order for them to do a good job at finding out. And there's stupid things that happen to the parathyroid, usually fixable, but they really need to know what they're doing with that. But there's scary things that can be as well. There's a number of genetic disorders. It can be indicative of a cancer. I think it's lung and certain types of breast cancer, or any cancer that's metastasized to the bones. It can be indicative, I said dehydration, kidney issues. It can, of course, be stop taking so much damn calcium. So I know people who are like, if a little bit of calcium's good, they're going to supersize it, and they're literally taking thousands and thousands of milligrams of calcium. And also extremely high levels of vitamin D can also cause the calcium levels to go up in the blood. So any way you slice it, that should definitely be investigated by the MDs. And you had specifically asked about whether a specific herb in your formula was of issue, the guiban, which is a freshwater turtle shell. Which is very good, very nourishing to the bones, to the essence or jing. And I'm going to say, if their elevated calcium, the hypercalcemia in their blood is from excess calcium, then you might lay off the guiban. And you could look at that based literally on supplementation. It is hard to get too much calcium in normal food. But if they're popping, they got 50 supplements and a third of them have calcium in them, if they're popping Tums like it's going out of style for some reason, then you might consider cutting back on that. But other than that, I wouldn't over concern about it. Some of you, just because we're in the realm, some of you may have noticed the recent headlines, and I'm sure it's going to continue to grow. There'll be another month of vilifying vitamin D levels, because there was a recent case in England that was reported in a journal of somebody who had excessively high amounts of vitamin D. I mentioned this in class the other day after I read it. And I believe they were doing, I don't remember the specifics now, 150,000 IUs of vitamin D daily. They were also doing a number of other supplements, none of them quite as extreme as that, and I guess that's a new protocol that somebody's created. They just said some nutritionist recommended this to him. He started doing it, and after about 2 months started to have organ failure and a whole bunch of horrifying symptoms. I believe, if I'm not mistaken, one of them was very high calcium, now that I think about it. And I hate to say that, one bad apple out of the however many trillion people we have on the planet doesn't make that vitamin bad. I think vitamin D is is super important, but fat-soluble vitamin, so A, E, D, and K are all fat-soluble, which means they accumulate in the body. They don't change fast, where vitamin C, you pee it out in a couple of hours. Hey, gee. Ooh, I did not see something about psoriasis. Sorry. Oops, sorry, I gotta keep reading. Hard time getting in the morning, especially or feet ache, pain. Okay, I will try to get to that one. We'll see. If not, we'll get it next time or in class tomorrow. Luckily, they caught it before like organ failure. They took him off of that, gave him IVs, fluids, and within a few months went back to normal. And I thought, although I frequently will recommend I think everybody should be taking 5,000 IUs of vitamin D. Sometimes I'll recommend more than that. MDs will do up to 100,000 IUs once a week only, and that's usually vitamin D2, not D3. And the reality is, it should be based on their exposure to sunlight, because we need sunlight. Sometimes a genetic disorder doesn't allow us to process vitamin D. Or get your vitamin D levels tested. And I always shoot for at least above 50 on your vitamin D levels, ideally between like 70 and 90. If you're going in triple digits, you got too much. And so it's really funny. I just said this in class the other day. It's like, I think I've seen people with 150 or less, 150 to 100 where they were high. And I was like, oh, just stop taking it and retest it in 6 months or a year and make sure it's okay. And then we just had somebody in the student clinic whose vitamin D level was 250. They were taking, I think it was 60,000 IUs daily. They got it more than double what's considered the safe dose. And I was like, oh my God, please stop taking vitamin D. She's like, well, I cut back. I'm now only taking 10,000 IUs daily. It seems like this is the new thing. I don't know what TikTok post I missed that said we should do absurd amounts of vitamin D long term, but that may very well be the high calcium levels, is that it's trying to control that. I would say also there's a couple of medications, like lithium will also increase calcium levels in the blood. Forgot about the drug cause of it, and extreme osteoporosis can cause it. Calcium in the diet, like, yes, we need calcium, strong bones, calcium, magnesium, phosphorus. All of these are important to prevent osteoporosis. There is some large studies out of England, I believe, that found that more than 2,600 milligrams, which ain't a lot, like that, what is that, 2.5 grams of calcium, total calcium daily in the diet actually causes heart disease. So when we're taking 600 milligrams of calcium in the poorest supplements, and then you're eating the bones in your canned salmon, and then your multivitamin has another 500 milligrams, and then you eat a bunch of dark green leafy vegetables that are very high in calcium. And all of a sudden, if you start to do the math on that, you're getting very close to causing some potential problems. So when, there's a lot of folks out there who have just the line of supplements, and they don't know why they're taking them. They're not doing the math on those. And so, A, it's super expensive, but B, there's a number of different things like the fat-soluble vitamins. We should be doing the math on that and make sure they're still within the safe dosage range. And things like calcium, I think it's important to make sure that hypercalcemia is not being caused from oversupplementation. Without a doubt, Tabitha, make sure that they go and see, that they chase that down and find out why. And hopefully it's something simple like they need to drink more water. It's summertime, it's easy to get dehydrated out here. All right, I got a half an hour to get the rest of these in. All right, that was that one. TMJ. So it's too late in my mind to. This is the temporal mandibular joint, the TMJ. So this gets out of whack where your jaw goes into the rest of it, and you can't open your mouth properly. They're oftentimes misaligned, causes major teeth problems, a lot of pain. It can come from everything from stress to you're born with it. to injury, trauma to the area. Any number of different things cause. Was that yours, Amanda? So there isn't a short answer for it. I always go starting with the cause is really important. And the person who wrote that in had used golden seal, which I wouldn't have thought to use that for that. I find most TMJ is trauma or stress. That's the biggest driver for that. And then the client reported seeing a bunch of parasites in the poop. And again, surprising if that would cause it, but you know what? I get surprised all the time. And so parasites would cause stress, it can cause anemia. I don't usually use golden seal, although it can be used for some parasites because it's an irritant. I do, and it's funny, the term parasites is always used very loosely in alternative medicine. So things like SIBO, small intestinal bowel overgrowth, golden seal is phenomenal for, and will come out as kind of phlegm in the stools sometimes. So if there was some candida, some SIBO, some sort of die-off like that, that could definitely be conceived of as parasites. I'm gonna before I say herby stuff, I'm gonna say TMJ. Everything from mouth guards that can be used because there's oftentimes a lot of teeth grinding with it. I think massage therapists who specialize in that can be really helpful. There's some literally they get in the mouth not comfortable and will actually do massage inside the mouth and on the jaw, and acupuncture can be really helpful for that as well. So I think in that chiropractors can have a role in that because sometimes some good adjustments. It can be linked in with the atlas, kind of the upper cervical spine, and the atlas can oftentimes go hand in hand. Is it the chicken or the egg of what's causing those to be out of whack? But I usually look at trauma and stress, and those oftentimes go hand in hand. So your antispasmodics, nervines can be really helpful. And the trick is, how do we get those to the upper body? And I'll use, and I'm going to just say the one Chinese herb I really like for it is Qiang Ho, and sometimes Gao Ben, or Bai Ji. But Qiang Ho is generally what I use to guide to that part of the body. Other things that will go there, sorry, I forgot Fang Feng. Feng can go there. And Western herbs, I like kudzu, if I can spell, kudzu. Kava can be really helpful. Those are my biggies. And any of your nervines. We have other antispasmodics. We have lots of painkillers. But the trick is to either guide them to that part of the body or make sure they're tissue specific. So things like black cohosh, valerian are actually great antispasmodics, but they tend to be a little bit better for the abdomen. We see those used for low back pain, antispasmodics, for menstrual stuff. Oh, I forgot mullein and Solomon seal. Oops. Close enough. Solomon seal are great for that. Those are the ones I can think of off the top of my head. And I haven't had a chance to think about them. So, those are my biggies. Topicals can be really effective. And so I always say topicals along the side of the neck. These are all part of that connection, but also along the jawline. all the muscles there, and actually above the ears. Sorry, can you see my, whoops, there we go. Above the ears, there's actually muscles, you got a muscle head there. So all the muscles here and down. Points that can be helpful for that, LI4, which is right here, Sanjiao 5 and 6, right here can be helpful. Gallbladder 34 on the side of the knee. SI3 here on the side, pinky side, on the side of the hand can be helpful. Auricular therapy, ear seeds, or ear needles, if you're an acupuncturist, can all be helpful for TMJ. And there's lots of local as well as other distal points on the hands and feet. 4 gates can be helpful for that. TMJ, those are the biggies. And it's always like I said, trauma and stress are the bigger drivers. That doesn't mean that parasites weren't it. That doesn't mean malnutrition and critters cause malnutrition. If you got a bunch of squirmy things in your belly sucking all the perfect food that you're eating, then that is an appropriate. People who have literally worms in their poop, like I always send them to a gastroenterologist because we need to know what critter so we can get rid of them. Tapeworms, you can't just use an irritant. You actually have to get them to let go of their grip on the intestinal wall. We have to look at life cycles and so forth. So I always think it's important that, you got parasites, let's not kill the host along with the parasite. Also, you can look at blood work, as long as I'm talking about blood work, whoops, eosinophils on your blood work. If those are high, like for real out of range, not high end of normal, elevated out of range eosinophils are in blood count. And I also look at exposure. Does the dog sleep in the bed? Are you a farmer and you crap in your fields? There's lots of ways that we can get parasites. And oddly, and I'm going to cheat because there were some questions about autoimmune disorders, parasites can be helpful. So there's and I do not recommend this. I know people who do it. There is some good supporting information. But again, do not recommend this. I've never told anybody to do this, but hookworms actually tend to put autoimmune disorders in remission. Go figure. So there is a black market trade in hookworms. People travel to Africa and walk around barefoot in the fields there by the pig pens and get hookworms. So honestly, I've never treated hookworms. My guess is, it's highly contagious through poop. And I believe there are some long-term potential consequences of hookworms, malnutrition being one of those. TBIs. All right, so I'm going to crank this out. I'm doing good. I got 30 minutes. So TBIs, traumatic brain injuries, we're really seeing it's funny, 20 years of war in Afghanistan and the Middle East, we've heard, because of all the roadside bombs and things like that, through the military, we've heard quite a bit about TBIs, the traumatic brain injuries, but also, I forget the name of the movie that was about football players, and that we've seen all of these horrible long-term consequences of football players, and that's from TBIs. That's them banging their heads against each other on the line of scrimmage. That all of them are getting multiple concussions from the time they're in a peewee league in elementary school, high school, college, and then professional ball. They're oftentimes ending up with everything from severe memory loss to mental emotional disorders, to include the violence. A lot of the violence that we see in professional athletes, football players in particular, is thought to be related to TBIs. as well as early deaths and strokes are all being related to that kind of a thing. So we can get that from any head injury, car accident, bad falls where you conked your head. In the case of the military, we often see that as concussive TBI, where it's not that they got hit with a roadside bomb, but the blast, that blast wave or sound wave that comes off of that will show no injury on the outside, but the injury is that wave will pass through our more dense material of our skin and brain and so forth, and cause damage to the brain without showing any external damage. And we don't see that first symptoms until sometimes days afterwards, depending on the severity of the TBI. It's one of the reasons when somebody gets knocked unconscious, they frequently will keep you, like, you got knocked out for a split second. They'll keep you in the hospital overnight, because sometimes it's 24 to 48 hours after the injury that those symptoms of brain injury, brain bleed, I said it right, subdural hematomas, things like that oftentimes show up afterwards. So we look at everything from nausea, vomiting, dizziness. The pupils are either not responsive or different. Sensitivity to sound or light, challenged consciousness, all of those can be short-term symptoms of a traumatic brain injury. Treatment for that, there isn't a single good one. There's definitely herbs that can help. There is a number. Acupuncture can be helpful sometimes. There's actually specific techniques of scalp acupuncture that we use for a variety of brain things. Cranial sacral work. If you can find somebody really talented at cranial sacral work, and I don't know how to do that, a lot of massage therapists, some chiropractors, some acupuncturists are trained in cranial sacral. There is a school here in the Tampa Bay area that I've heard good things about. That can be super helpful. There is a lot of work being done with hallucinogens, everything from psilocybin mushrooms to LSD to ketamine. Are being researched specifically for TBIs, generally to good success. There's some research, I believe, with TBIs for magnetic, deep brain magnetic resonance. I'm saying it wrong, but I believe there's some research on that for TBIs. From an herbal standpoint, oh, sweet, I did not know that. So Ashley's one of our herb students. So, oh my God, what's Ashley's last name? She's around here somewhere. She's an LMT, a massage therapist, and it would not surprise me that she was good at it, since she does a lot of really good subtle work in her stuff. So the herbs that we can use, always a go-to is something like the go-to cola. Depending on how the symptoms are showing up, we can use, I really like milky oats for this, but because we've had an injury, especially in the acute phases, I think it's important to put something in there that is a gentle blood mover. In the same way that, if we have bruising, if we just sprained our ankle and it's swollen up, well, there you go. We would put herbs, we would take internal herbs to help with that physical trauma. And so in the early stages, I would say I would extend it into the first month after a brain injury. It would be appropriate to use things that we would use in traumatology internally, and that could be something like calendula, plantain, the Shen, There are specific herbs or specific formulas in Chinese medicine that is escaping me. It's not that is specific for blood stagnation in the head, and if any of you remember off the top of your head, it's part of the Zuyutong family of herbs, so not Shen Tong Zuyutong. It's a little bit more obscure, and I've drawn a blank on it. We can use herbs like the Gotu Kola to drive to the head. The Qiang Ho that I mentioned earlier guides to the head. Gao Ben guides to the head. The Baiji guides to the head. Dan Shen is super appropriate. Ginkgo is a mild blood thinner and guides to the head, and I'll put a caution on that. It's very drying. And so if you don't have phlegm, you need to add moistening herbs with that so it doesn't actually dry things out too much. Long term, I would say some of your nootropics like the lion's mane in high dose might be appropriate. Saffron might be a good choice. It's super expensive, but you don't need a lot because you oftentimes see with TBIs, you see depression and anxiety. So adding those herbs in. Milky oats, super appropriate for that. I feel like I'm forgetting somebody. If you tend to run cold, there's a South American herb that I'm a huge fan of. Malungu is one I think we're going to see more and more on. For the anxiety, any of our anxiolytics, super appropriate to use kava as needed for the anxiety, but any of our anti-anxieties would be appropriate as well. Acupuncture points or acupressure points, the Buddhist triangle, which is heart 7, pericardium 6, and lung 9 would all be appropriate. The auricular therapy can really help just to balance things out. So the NADA protocol, the 5-point protocol would be super appropriate. Yeah, those are my biggies for TBIs. Yeah, we haven't done anything cool and metaphysical. And this one's a little bit more Chinese, but it's super fascinating. And I forget whether I was talking about it in a class recently or whether I was talking about this in the last month or so. But we talked about, like, when we talk about the 5 element aspects on Chinese medicine, and we have these elementals, we have fire, earth, water, metal, and wood. And each one of those, we have organ correspondences, we have seasonal. It's so much of the foundation of some of what we do in Chinese medicine. But one of the interesting things that we have is the spiritual aspects that we associate with each one of those. So Shen is the fire heart element. The Yi is the earth spleen element. The lung is the Po is the metal, and I'm going to say air. Lung element. The Jur is the water. Kidney element, if I can spell kidney. Oh well, you guys know what I mean. And the Hun. There we go. Hun is the wood and the liver element. And so each one of these, we see interactions with each one of them, unique characteristics, and some expansion of that. And there's the foundational concepts within Chinese medicine, but also I think that there's an offshoot by the Worsley 5 element that really takes it to a next level of understanding some of this. And so specifically somebody was asking questions about how this relates to schizophrenia and some of those more serious mental health conditions where people are seeing and hearing voices. And I've worked with a few folks that are dealing with things like bipolar, schizophrenia, psychosis, where they can tell you that they're having conversations, they're seeing people or multiple people, having conversations with them, that is as real as any of you are, except you're in the ether world, so you're kind of not real, except for the ones of you who I know. And it's thought that the Shen is our dominant spiritual force that in our waking state. And the Hun, controlled by the liver, takes over in the evening time and is more about the dream world or the dream state. And that if we're hallucinating, if we're seeing things that the rest of the world doesn't see, that has a relationship to those two are mixed up. And so if our Shen is weak, for instance, and it does not hold its status as the dominant spiritual aspect during the daytime, if you will, in our waking state, and the liver or the wood element is excessive or forceful, it can force its way, that dream state, the Hun, the spiritual aspect of the dream time, can force itself into the waking state, i.e. where we see paranoia or violence and so forth. And just because I can explain it doesn't mean it's easy to cure. And that's the downside of it. And I would say I think you can find it on YouTube still. Giovanni Maciocia, who is, I think, one of the better textbooks out there. He has a book specifically on looking at Chinese medicine and mental emotional health. It's a great book. He also has, I think you can still find it. He's passed away a couple of years ago, but he had an 8-hour seminar specifically on Shen Han Po and a deeper understanding of that you could get as a DVD. And he has some fairly detailed, lengthy, free YouTube videos specifically on that he might be able to go deeper into that. I will say that a lot of times when we're seeing things like schizophrenia, the liver is frequently on fire, and that has to be subdued. And that anxiety, there's oftentimes either an excess or a deficiency in the heart or in the Shen. And so creating a balance in those as best we can will at least reduce the severity of those issues to a point. Not to say that it's easy, that it's permanent. I won't claim cure, and I'll claim a cure on a lot of crap. Mental health issues are a challenge always to work with. I'm super excited to say one of my graduates who was a practitioner helped me supervise student clinic, Sierra. Literally last Wednesday was her last day with us because she's been accepted to Dragon Rise's school in Gainesville, which is a acupuncture school that specializes in mental emotional issues specifically. And Leon Hammer, who's the founder of that school, was a psychiatrist who ended up going to China, learning a lot about Chinese medicine, and basically created he kind of took two different unique pulse diagnosis concepts, created his own Hammer pulse diagnosis and some of his own practice and dealings specifically with mental health issues. And so Sierra's specialty was dealing with mental health issues. And my one thing I would just generically say, we see phlegm frequently with severe mental health issues, and phlegm and heat. And one of the major drivers of many mental health issues as food. And we don't usually recognize the role of food in mental health, but specifically gluten will aggravate most conditions, and she's seen it probably, she's been a practitioner at the clinic for 3-4 years now, and I would say half of her practice has been dealing specifically with mental emotional health, and seen dramatic improvement and aggravation specifically with gluten. There's oftentimes other food sensitivities that are drivers to that, and when we look at food sensitivities, they can cause phlegm, and they can cause heat, and so it would be very easy to see how that would be an aggravator, because we also see there is congenital issues, like if mom was schizophrenic, there's a good chance that somebody else in that familial line may end up with that mental health issue. So not a surprise that there is more than one cause and more than one aggravator as we see all of that happening. So I know that's the short version, but maybe that gives you a little bit more push in a particular direction. Giovanni wrote the book on mental health, so if you're into books more than listening to YouTube videos or buying DVDs, his book is very Chinese medicine focused, so if you don't know Chinese medicine, you won't like it. It's a good reason to join the Chinese program. All right, I got 6 minutes to say everything I know about psoriasis. Psoriasis sucks. So psoriasis is an autoimmune disorder, and there are different types of psoriasis, and they can morph one into the other. The particular crappy one is psoriatic arthritis, which is psoriasis that then starts to create arthritis. One of the, obviously, if all of a sudden somebody's like, yes, I've had psoriasis since I was a kid, and now I have, I'm 35 and I have this horrible crippling arthritis, that's psoriatic arthritis. But not everybody knows, like, they may have had psoriasis as a kid, then they're like, oh, I outgrew it. And one of the tells that I learned years ago is pitting, like holes in your fingernails. Many things it can be, but one of those is that can be a sign of psoriasis that people get into the fingernails, and that can be indicative specifically of it going into that arthritis stage. The Western treatment is frequently things like make sure this isn't relevant to, oh God. Oh, nope. I'm not going to take care of that right now. It is frequently used with immunosuppressants, steroids, chemotherapy even, all the things that we classically use with autoimmune disorders. As with most autoimmune disorders, I find, I should have been a nutritionist. I find food is a major driver for it, and so trying to figure out what the food sensitivities are, and these are like, it's easy to beat up on gluten in corn and dairy, and certainly those are some of our most common food sensitivities that we see. When I see psoriasis, and I'm going to just say chronic autoimmune skin disorders, it's sometimes something weirder than that. And so, yes, a lot of digestive issues, like those are, yeah, it's gluten, chronic sinusitis, rheumatoid arthritis, it's either or sulfur in wine, certain seafoods, things that you don't normally go after. So food diaries, comparing that to a variety of symptoms like poop, like emotions, but also specifically in flare-ups of the psoriasis. And then also, both in Western and Chinese, we see that correspondence between the gut health and the skin, and ultimately the lungs, if we're talking Chinese. So a lot of our chronic skin conditions, everything from acne to psoriasis, we tend to look at reducing the inflammation in the gut, the lung, and the large intestine in particular. And so things like burdock, I find calendula really helpful, plantain, sometimes the nourishment of stinging nettles is really helpful in a case like this. Oddly enough, sunlight seems to have a direct positive impact on psoriasis. So getting out in the sun, I would argue salt water as well. Although I've seen it so severe, like their entire body is just one big collection of flakes, where their body image issues of going out and going swimming isn't always within their comfort zone of all of that. Probiotics, in particular soil bacteria, that's a growing field looking at the soil bacteria. Megaspore is the kind of, I won't say the only company, but it's one of the first companies, very popular. They have good products, a little pricey, but they're good products. And so sometimes that can be really helpful to look at that gut biome when it comes to that. I generally don't do a lot of topicals for that unless they're having flare-ups. Oh, and I forgot one of my favorites. Crap. Smilax. I always regret saying this, sarsaparilla, in different traditions, that's a different herb. So in the Caribbean, Jamaica, Bahamas, sarsaparilla is smilax. So we have the greenbrier smilax that grows here. The herb of commerce is oftentimes Smilax medica. Those are specific for inflammatory skin conditions when there is phlegm showing up as a skin issue. And that can be something we see on the tongue. That can be something that's phlegmy or a lot of white, crusty stuff around it, so not just skin flakes. Also, according to Chinese medicine, and I usually follow these principles as well, there's always a underlying blood deficiency. And let me clarify that, and then I'm almost at the end. When we look at blood deficiency, that can be actual anemia, but it can also be things that appear like anemia, even though the blood values are the same, or something like phlegm or trauma to an area, and that can be a chi blockage, a phlegm blockage, actual physical damage that doesn't allow the blood to nourish the skin. And so we see that flakiness that comes with psoriasis, the itching that can come with psoriasis. That's actually a weakness in the skin. That is, the blood's not nourishing and protecting the skin, and that's allowing for that wind evil. That's a whole other thing, they will get to that next month, that allows for that itchiness or that invasion of stuff. So making sure that we nourish that spiritual energetic concept of blood, but also checking for anemia and malnourishment. I think I got everything on the list. Holy crap. All right, so I'm going to wrap this up. If you don't know, I'm Bob Lindy from the School of Herbal Studies. We do this the last Friday of every month, except for this month because I had a conflict. You can find out more at traditionsherbschool.com. Our clinical practice and also our intern clinic, you can find out more at acuherbals.com. Please follow our YouTube page, and I know I rambled off a billion things, so I will upload this to the YouTube page sometime in the next couple of days so you can access it. Also, I've been doing this for about a year or so now, of doing this open forum, so you can see all the past ones and all the insanity that I babbled incomprehensibly, and know that these are just me talking off the top of my head, but 20 plus years of experience, I usually come up with some pretty basic, safe, good ideas. None of this constitutes health advice. And I'm super excited that we have a great new acupuncturist that will be starting the next week at the clinic. And don't forget, we got cool things besides our full apothecary that you can come and buy herbs by the gram with well over 800 herbs. We've got a plant nursery in the back with lots of edible and medicinal plants. All of our classes are held here at the school, 6340 Central Avenue, where we got a half-acre teaching garden and lots of other cool stuff. And I hope I see you at a conference, in a class, check out all of our cool classes on our website. Follow the school or me or whatever on Facebook so you can catch all the other crazy stuff that we do. And most importantly, I think there's a ton of good stuff on our YouTube page. Please share it with your friends and whoever, because I am slowly, painfully trying to monetize that, where I need more viewing hours. So watch lots of things, even if you're not in the room. Watch the YouTube video. Thank you all for giving up your Friday evening, and have a wonderful, safe weekend. And I know I'm going to see some of you in class this weekend as we talk about all of the immunity and lymphatic coolness in class. Boop.